guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering the most important things that you guys need to know in regards to medication administration. I'm going to teach you all of those important concepts that have been seen on NCLEX, on ATI, on HESI, on those important midterms, exams, finals, okay? So I'm bringing it back to the basics. Why? Because there's so many questions that I see students know the information they could have passed. They could have gotten that question correct, but because they forgot the basics, which a lot of questions are based on the basics, they get it wrong, okay? So I'm going to teach you those important concepts. If you haven't done so already, please, guys, don't forget. Like and subscribe below. Drop me a comment if there's any content that you'd like to see me cover, and I'll make sure I make a video for you. So without any further ado, let's get started. A client is nauseated, has been vomiting for several hours, and needs to receive an antiemetic medication. The nurse recognizes that which of the following is accurate? A, an enteric-coated medication should be given. B, medication will not be absorbed as easily because of the nausea. C, a parenteral route is the route of choice. Or D, a rectal suppository must be administered. And I'll give you a moment to think of your answer. And the correct answer is 3, a parental route is the route of choice. So what's going on? This patient is vomiting, they have nausea. We don't want to give them anything that they can possibly throw back up. So number one, giving them an enteric-coated medication. Anything that's enteric-coated, you know you're giving it by mouth. Why? The reason that's enteric-coated is so that it doesn't start to dissolve in the mouth. Remember, your mouth contains enzymes that breaks things down. So it doesn't, the reason it's enteric-coated is because we don't want it to start breaking down in the mouth. We may not even want it to start breaking down in the stomach until it's been in the stomach for a while, then go to the small intestine, right? So that's not going to be our answer. Then you have choice 2, medication will not be absorbed as easily because of the nausea. That's incorrect, okay? The nausea has nothing to do with absorption of medication. Then you have choice 4, a rectal suppository must be administered. Guys, don't forget what I taught you about absolutes. Okay, if you see a question, you do not choose an absolute unless you know beyond the shadow of a doubt that that's correct answer. Okay, so what are absolutes? Remember, must, only, always, never. Those words such as that are absolutes, and they're usually the wrong answer. Do not choose an answer that has an absolute unless you know beyond the shadow of a doubt that that's the correct answer. Okay, so the correct answer in this case is 3. And why do we like the parental route? So guys, you have enteral and you have parental. Enteral is a route that uses the GI tract, right? Such as going in through the mouth, it has to go to the stomach, that goes through the GI tract, or even a suppository, right? Rectally. But guess what? Parental, that bypasses the GI tract. So parental, perfect example of parental route would be IV. Next question. The client receiving an IV infusion of morphine sulfate begins to experience respiratory depression and decreased urine output. This effect is described as 1, therapeutic, 2, toxic, 3, I can never pronounce this word, idiosyncratic, or 4, allergic. And so the correct answer is 4, toxic, okay? So guys, what do we know about narcotics? Narcotics are great pain relievers, right? But one thing that narcotics do, they slow everything down. And so if the patient starts to reach a toxic level of the narcotic, right? Instead of your respirations being 12 to 22, right? It'll go down to 8, it'll go down to 9. That patient's getting a toxic level of that medication. Let's look at our other choices. You have 1, therapeutic. Therapeutic is when a patient has an expected, a wanted response to medication. Patient's blood pressure is high, we give them an antihypertensive and their blood pressure goes down. It doesn't go down to the point that their blood pressure is lower than 90/60. It just goes down. It goes down to a therapeutic range. It goes down to a range where we want that patient to be. 3, idiosyncratic. That is when a patient has an unexpected reaction to a medication. And not only is it unexpected, we don't know why it happens. Okay, when you see that word idiosyncratic, that's what I want you to think of. Something that happens and we don't know why. And then choice 4 is allergic. So allergic reaction, guys, obviously is a negative reaction by the body's immune system, okay? So in this case, that patient that's getting morphine sulfate, morphine is a narcotic, right? And now we see that they're having respiratory depression, which means that their respirations are less than 12, and we're seeing decreased urine output. That patient is getting a toxic level of that medication in their body. Next question. The client is to receive a medication via buccal route. The nurse plans to implement which of the following actions? 1, place the medication inside of the cheek. 2, crush the medication before administration. 3, offer the client a glass of orange juice after administration. Or 4, use sterile technique to administer the medication. So the correct answer is 1. When you see that word buccal, that means what? Inside the cheek. So that's exactly where you put it, the medication in the patient's mouth between the tongue and the cheek, okay? And what happens is those enzymes that are on your tongue, in your mouth, in your saliva starts to break down that medication. Look at 2, crush the medication before administration. Absolutely not. Your saliva, your enzymes within your saliva is going to dissolve the medication. You don't crush it. 3, giving a glass of orange juice. No, when you're giving a medication via buccal route, you don't give the patient anything to eat or drink during the administration of the medication or immediately after. Why? It's going to slow down the absorption, which you don't want to happen. And the last choice, sterile technique, come on, absolutely not. This is not something that's invasive, right? So when you're giving a patient medication via buccal route, you just want to use clean technique, which means you're going to put on gloves. And remember, you're going to put on gloves in any situation where you expect something wet. Something wet, such as saliva, such as blood, such as vomit, such as feces, right? If it's wet, you expect it to be wet, you're going to wear gloves. The nurse is documenting administration of a medication that's given at 10 a.m., 2 p.m., and 6 p.m. The medication that the nurse is documenting is 1, morphine sulfate, 10 milligrams every 4 hours is needed. 2, Intradermal, 10 milligrams by mouth twice a day. 3, diazepam, 5 milligrams by mouth 3 times a day. Or 4, K-Flex, 500 milligrams by mouth every 8 hours. By the way, guys, I've gotten some comments saying, Professor D, you're going too fast, slow down. Press that pause button, guys. The questions stay up. Just press the pause button and you can have as much time as you want to kind of think of your answer before I go ahead and go over the answer and the rationales, okay? So for this question, the correct answer is 2, diazepam, 5 milligrams by mouth 3 times a day. And if you go back to the question, 10 a.m., 2 p.m., 6 p.m., that's 3 times a day. Let's talk about why the other choices are incorrect. You have choice 1, which is morphine sulfate, 10 milligrams every 4 hours. We have 10, 2, and 6. Well, here's the problem with that. Between 10 and 2, that's 4 hours. And between 2 and 6, that's 4 hours, right? But that's not every 4 hours, because if medication was really being given every 4 hours, how often will we be given that medication? 6 times a day. Why? There are 24 hours in a day. 6 times 4 equals 24. So if we're giving something every 4 hours, you expect to see 6 administration times, not just 3. Second choice, your Intradermal of 10 milligrams by mouth twice a day. Well, obviously, you know it's not twice a day because this medication, as you can see, is being given at 10, 2, and 6. So that's wrong. And then you have choice 4, and that was placed there to trick you. I hope you didn't fall for it. Your K-Flex 500 milligrams by mouth every 8 hours. Well, if you go back and look, this medication's been given 10 a.m., 2 p.m., and 6 p.m. So that's not 8 hours. So yes, it's being given 3 times a day. 8 times 3 is 24. Wonderful. But it's not being given every 8 hours. Every 8 hours means there's 8 hours between every time that medication is being given. And that's just not the case in this question. The nurse is working on the pediatric unit. In preparing to give medications to a preschool age child, an appropriate interaction by the nurse would be 1. Do you want to take your medication now? 2. Would you like the medication with water or juice? 3. Let me explain about the injection that you'll be getting. Or 4. If you don't want to take the medication now, you will not get better. And I'll give you a moment to think of your answer. Guys, the correct answer is 2. You ask them if they want to take their medication with juice or water. Why? When you do that, you're letting them know you're going to be taking this medication, but I'm still giving you a choice. When you do that, you're still allowing that patient, even though they're 2 years, how is the patient? Preschool, excuse me. They're preschool age, they still want to have a sense of decision making, a sense of choice, okay? And when you do that, you help relieve that patient's anxiety, all right? You're not going to say, 1, do you want to take your medication now? What do you think the answer is going to be? They're going to say no, and you have to give that medication. Choice 3, let me explain about the injection you'll be getting. Remember, your teaching has to be age appropriate. So whereas an adult, you'll explain to the adult about the medication they're taking. Or preschool age child, they don't have the mental capacity for it. So you explain to them that they're going to be getting a medication, but it has to be short and sweet. It's not something you're going to be explaining about that medication because they don't have the cognitive ability at preschool age to even digest what you're telling them. As a matter of fact, all you'd be doing would be increasing their anxiety. Then you have choice 4. If you don't take the medication now, you will not get better. Guess what? They don't care. They're preschool age. The preschoolers cannot think past right now. All preschoolers can think about is the here and the now. All I know is right now, I don't want to take that medication. They don't have the mental capacity to think about later that if they don't take their medication, they can get worse. They can get sicker. They're not going to heal. They do not have that mental capability. So you'd be wasting your time. What you want to do is let them know they're going to take their medication, but you're still giving them a choice. Okay. And so number 2 is the perfect option. Next question. The nurse is teaching the client how to prepare 10 units of regular insulin and 5 units of NPH insulin for injection. The nurse instructs the client to 1, inject air into the regular insulin and then into the NPH insulin. 2, withdraw the regular insulin first. 3, inject air into and withdraw the NPH insulin immediately. Or 4, inject air into both vials and withdraw the regular insulin first. And by the way, guys, I know you guys are watching from different states, but I'm based here in Florida. And let me tell you, for the Florida boards, New York, Georgia, California, a few others, I'm going to do a video on this one of these days. But anyway, they kill you with diabetes questions. They kill you with insulin questions. So I'm telling you now, you have to know your insulins. You have to know diabetes like the back of your hand. That's not one of the subjects that you think you're just going to learn in nursing school and be done with it. They kill you with those questions. And the reason for that is because there's such a large geriatric population. And by the time the people have lived on this earth for that amount of time, chances are they're diabetic, along with some other disease processes. But that's one of the biggies. So you got to know the stuff. All right. So how do we draw insulin? The correct answer is 4. You want to inject air into both vials, withdraw regular insulin first. You always want to go clear to cloudy. Your regular insulin's clear, so you're always going to draw the regular. You're going to draw the clear first, then the cloudy, which is your NPH. Now, the reason that you inject air is because you want to create a vacuum so you can actually get the medication out. So when we go back to the question, they want 10 units of regular and 5 units of NPH. So what you're going to do is 10 plus 5 is 15, right? So you're going to pull back 15, right? inject 5 into the NPH, then inject the remaining 10 into the regular, then pull your 10 out of the regular, and then pull 5 out of the NPH. And that's why number 4 is the correct answer, okay? Next question. The student nurse reads the order to give a 1-year-old client an IM injection. The appropriate and preferred muscle to select for the child is 1, deltoid, 2, dorsogluteal, 3, ventrogluteal, or 4, vastus lateralis. Okay, guys, so this is a 1-year-old child. So the correct answer is 1, your ventrogluteal area. That's where you're going to give that injection. Why? By 7 months old, that muscle's well developed. So it's a great place to give it to a 1-year-old. Let's look at our other choices. 1, deltoid. By 1, that muscle in that upper arm is not developed. Okay, so you try to give an injection there, it's probably just going to be sub-Q. There's no muscle there yet. So that's out. 2, dorsogluteal. Don't you dare. Don't you dare. Okay, I want you to think about it. Think about how tiny a 1-year-old's body is, okay? That increases your risk of hitting what? The sciatic nerve. And if you hit that sciatic nerve, that patient is going to have sciatic pain for the rest of their lives. We don't play with that. So you're going to stay far, far, far away from the sciatic nerve. So you will not be giving anything in the dorsogluteal to a child that small. Then you have 4, the vastus lateralis. Now the vastus lateralis for IM, we love it, but we love it for children who are older than 1 year old, okay? So this is why the ventrogluteal is the correct choice. The nurse administers the IM medication of iron by the Z-track method. The medication was administered by this method to 1, provide faster absorption of the med, 2, reduce discomfort from the needle, 3, provide even more absorption of the drug, or 4, prevent the drug from irritating sensitive tissue. And the correct answer is 4. You want to keep it from irritating sensitive tissue. So guys, iron is very, very irritating, okay? And not only do you want to keep it from irritating sensitive tissue, you want to keep it from staining the tissue. So the reason you give the Z-track method is you're sealing it in. So, you wipe it off with alcohol, right? Then you move the skin over, you give the injection, then you release the skin. Because remember, when you pulled that skin over, then you gave the injection. The minute you let go and release the skin, what happens? The skin goes right back to where it was. So it seals that medication in and prevents it from leaking out. Before we move on, there's some very important things that these concepts you have to know for iron. It pops up on test questions over and over and over again. So iron, very irritating, very constipating. Of patients taking iron, you have to teach them to drink lots of fluids. And when I say fluids, I mean water, okay? Not juice, because juice has lots of sugar in it. What does sugar do? It, what's the word I'm thinking of? It just binds everything up and will make them feel more constipated. It's going to be harder for them to have a bowel movement. So you want them to drink water. Eat foods with lots of fiber, such as fruits and vegetables, because iron's constipating. What else do we know about iron? If the patient's taking iron by mouth, they need to drink it through a straw because it will stain the teeth. Okay? Which leads me to my next point. You're going to teach them, you may notice that your stool is very dark in color. That's because of the iron. You have to teach them that or they'll freak out. So those are some very important things that you guys should know about iron. Next question. The client's ordered to have eye drops administered daily to both eyes. Eye drops should be instilled on the 1, cornea, 2, outer canthus, 3, lower conjunctival sac, or 4, opening of the lacrimal duct. And I'll give you a moment to think of your answer. The correct answer is 3, the lower conjunctival lower conjunctival sac. So guys, when you guys are placing in eye drops, 1 to 2 eye drops in the lower conjunctival sac, so it's right here, you just go like this. You see how I just made a pocket, and you put it in the center of that pocket, okay? And that's the correct answer. That's how you give the eye drops. Next question. Following the administration of ear drops to the left ear, the client should be positioned 1, prone, 2, upright, 3, right lateral, or 4, dorsal recumbent with hyperextension of the neck. And I'll give you a moment to think of your answer. And the correct answer is 3, the right lateral. So if they're getting it in their left ear, you want them lying down on their right side. And that way the medication goes in their ear without you worrying about it leaking out. So that's the correct position that you would be placing the patient when you're administering ear drops. Next question. In orders written for Demerol 500 milligrams IM intramuscularly, every 3 to 4 hours is needed for pain. The nurse recognizes that this is significantly more than the usual therapeutic dose. The nurse should, 1, give the 50 milligrams IM as it was probably intended to be written. 2, refuse to give the medication and notify the nurse manager. 3, administer the medication and watch the client carefully. 4, call the prescriber to clarify the order. You guys ready? Okay, the correct answer is 4. You're not going to give it. You're going to call the doctor and clarify the order, okay? When you look at the question, it says that the nurse recognizes that the order is significantly more than the usual therapeutic dose. So as a nurse, you recognize something's wrong with this order. What are you going to do? Choice 1, go ahead and give it because that's probably what was intended. No, you don't. You will lose your license so quick. 2, refuse to give the medication. And let me tell you, these are how these test writers trick you. Because a lot of times they'll give you a portion of a question that's correct and everything else is wrong, okay? So 2, refuse to give the medication. That's great. You don't give it, right? But look, it goes a step further and says notify the nurse manager. Why are you going to notify the nurse manager? Is the nurse manager the person who gave you the order? Are they the one who wrote the order? No. When you don't give a medication, don't you have to call the doctor and let the doctor know why the med wasn't given so you can get new orders? So why would you let the nurse manager know? You're not going to give the medication and you're going to call the doctor, the person who wrote the order. So 2's wrong. Then you have 3. You know something's wrong, but go ahead and give the medication and watch the patient carefully. Absolutely not. You're going to withhold the medication and call the physician with your concerns. A client is to receive a MAN2 test for tuberculosis. This test is administered via an intradermal injection. The nurse recognizes that the angle of the injection that is used for an intradermal injection is 1, 15 degrees, 2, 30 degrees, 3, 45 degrees, or 4, 90 degrees. And I'll give you a moment to think of your answer. Correct answer is 1, 15 degrees. When you're giving an intradermal medication or injection, you're going to do it 5 to 15 degrees because remember, you want it to be placed right under the skin. That's what intradermal is, okay? So the degrees is going to be 5 to 15 degrees. Something else you have to know about the MAN2 test, you have to recognize the other names for it because it might not say MAN2. It might say skin test. It might say PPD. They're all the same thing. Okay, that's that test, the screening tool that they use to check for tuberculosis. So it's done intradermal, 5 to 15 degree angle, bevel up, not down. There's one more thing you guys absolutely have to know about the MAN2. 5 to 15 bevel up. Oh, how much is is given, and this is a famous question they love to ask, and it's 0.1, okay? You guys have to know that. So bevel up, 5 to 15 degrees, intradermal, and 0.1 mLs is how much is given. Next question. The nurse prepares to administer an intradermal injection for the administration of medication for 1, pain, 2, allergy sensitivity, 3, anticoagulant therapy, or 4, low-dose insulin requirements. The correct answers to allergy sensitivity. So usually when it's intradermal, it's either being given because of 1, a MANTU / PPD / skin test, all the same thing, okay? It's either that or for allergy sensitivity, okay? It's one of those two things usually when it's an intradermal that's being given. A priority for the nurse in the administration of oral medications and prevention of aspiration is 1, checking for a gag reflex, 2, allowing the client to self-administer, 3, assessing the ability to cough, 4, using straws and extra water for administration. So the correct answer is 1, checking gag reflex. You better check that gag reflex before you give the medication. You have to make sure that patient can swallow and that they're not going to start choking and aspirate, okay? Let's look at our other choices. You have 2, allowing the client to self-administer. That's fine. We actually, if the client can, you want them to self-administer, but that's only after you've checked the gag reflex and you make sure that it's present. 3, assessing the ability to cough. That's wonderful, but if you have to choose between assessing their ability to cough and gag reflex, it's going to be gag reflex any day of the week. And 4, using straws and extra water for administration. You don't want to do that. And matter of fact, guys, when a patient has like they're at risk for aspiration, we like to give what? Thick liquids. Why? Because it's harder to choke on something that's thick than something that's thin, such as water. So number 4 is incorrect as well. The nurse is to administer several medications to the client via NG tube. The nurse's first action is to 1, administer the medication to the tube feeding being given. 2, crush all tablets and capsules before administration. 3, administer all of the medications mixed together. Or 4, check for placement of the NG tube. And guys, I'm not even going to give you a second because I've covered this so many times and in so many videos. I know you know the answer, and it's 4, right? That's the first thing you're going to do. Before anything else, you're going to check placement. You're going to make sure that that tube is where it's supposed to be in the stomach. You're going to check placement for anything else. All the other choices are incorrect. Oh, okay, I guess that's it. And I just made it under 30 minutes. I'm pretty sure because there are, I'd say about 9 or 10 other concepts that you definitely have to know about medication administration that I was not able to cover on this video. So just expect a part 2 coming soon, most likely next week. So I'll be working on that for you. Guys, please do not forget to like and subscribe below. That's actually what keeps things going so I can get more content and put it out there for you. So I'm asking you, please support me in that way by liking and subscribing, and put in the comment section if there's any content that you haven't seen me cover yet that you'd like for me to cover. Just let me know and I will do my best to make a video for you. Thank you for staying with me and watching this video, and I'll see you next time.